Hey everyone, it's Michael here at Home Health Success Academy, and you are in our Shortening the Sales Cycle video series. And in this video, we're talking about the no-powered referral source, right? That one person where we thought is the person that makes the decision to refer patients, but turns out to be does not really control it. So I was working with a client last month, and what was funny with this particular client was that I asked them, I said, well, what's one of the biggest reasons why you're not getting any referrals? Because they were just wondering. They've been in business for the past 3 years. They've purchased the business from another company, and they've been in this business and they've been still stagnant and having 15 to 20 average monthly census. And they'll go up to 30 every now and then, but drop back down. So they're averaging in their 15 to 20, right? And I asked them, I said, well, what is your limiting belief? And they said was that, well, we keep on going to these nursing homes. We keep on going to these SNF units or rehab facilities. And the only thing that we get from them is they keep on saying that the physician makes the decision in referring patients. And I said, all patients? And she said, yes. And I asked, who said this? And she said, well, that's what the social worker says. And so I was taken aback by this because I will never ever believe that a physician is the only person who makes a decision in referring patients to a home health agencies in a skilled nursing facility, a rehab facility, or any of those other facilities. Because yes, you need a physician order, but that doesn't mean the physician makes a decision on which home health they go to, right? So a lot of agency owners, administrators, DONs, marketers, account executives, whoever has this limiting belief that's saying that the physician makes the decision on which home health to go to. No, physician makes a decision to say a patient needs home health services, but barely and rarely is the person or the only person that makes a decision on which agency they go to. So I said, all right, I can see and I'll believe what you're saying, but from my experience, it wasn't. And so what I ended up doing this was I called up the nursing home, the skilled nursing facility, right in front of the client, and I said, hi, my name is Michael. I know that my client, I'll say the name, came in last month, and I wanted to be able to find out if I can have a minute of your time. I know you're busy. I promise I'll bring some coffee and some donuts if you will give me 30 seconds of your time. And of course, the administrator agreed, and we had a meeting with this administrator. And while we're in front of the administrator, I said, listen, I know that most of the time, once again, I didn't say all the time, most of the time physicians makes a decision which home health they want to be able to work with. If you don't mind me asking, what's the percentage that the physician makes a decision and doesn't? And she said that the physicians typically make 40% of the decisions. Most 40 of the patients who gets discharged, the physicians will determine which home health they go to. So then I asked, great, so the other 60%, who makes that decision on where they go? And she said, well, half of that is the social worker. The other half is the patient's choice, obviously, is what she said. And so right there and then when the administrator said that, I knew I was right, okay? And what's funny thing is this, is that when she said the other half, the other 30%, so 30% was a social worker makes a decision, the other 30%, the patient makes that decision, that is a half truth. Yes, 30% the social worker determines that, right? The other 30% the patient makes a decision. No, the social worker gave the patient a sheet of paper of the list of home health agencies that they want them to go to because they have a relationship with those. So really, did the patient choose it or did the social worker choose it? It's the social worker because they gave them choices. Just like anything else, when it comes to marketing, you must give choices to eventually allow the person to make the decision and think that they made the decision. You go to a restaurant. You went, let's say, for example, to a steak restaurant and you wanted something that wasn't in the menu. Can you get that? No. You have to go through what the choices are that is in the menu. It's the same exact thing. A chef determined that So in a nursing facility, a skilled nursing facility, the social worker still made the decision on which agency to choose. Your job now is to get into that list as well, okay? So it's not always the physician that makes the decision, and you need to be able to remove that in your mindset that the physician is the only person that chooses. There is never an always in this industry. Never such a thing. If you hear someone says they always, that is a falsification, that's a lie, because nothing is always certain in this agency world of ours, in this home health, home care, hospice world of ours. So you need to be able to understand that the physician is not the only one. Even though everyone thinks that they are the main decision maker, they are not. In physicians' offices, the physician most of the time does not make the decision. He tells the he tells the office manager, call this company, call them, they're going to refer. He may not even say that. He might just say, hey, this patient needs home health, home care. Find someone in there. Your job now is to become the person is in the list. You don't have to be the primary person in the list, but you should at least be second. But the one thing you need to be is this. It's not be 1, 2, 3, or fourth in the list, but you should be the first one that comes into the mind of them, even though you're second, third, fourth, fifth in the list. That's the most important thing, because the last thing you want is for them to pull up the list. You want them to think home health, your agency. You want them to think home care, your agencies should be in their mind right away. How do you do that? Top of mind. How do you do that? Making sure that you're touching them every week. Visit, email, phone call, text message, whatever you need to do, even a fax, you should do as well. As long as there's that open relationship that they actually allow you to fax. Remember, being top of mind beats anything, any number in a list that they have. Because like I said, and like that administrator said, 30% of the time, it's the social worker that makes the decision. The other 30% is then divided among who's in the list. But still, the social worker made the decision. So pretty much just in that facility, 60% is chosen by the social worker, never always by the physician. So right there alone, my client cannot tell me anymore that the physician always makes the decision. So understand that who you think is the person in charge of referring, it's never that person unless you ask the right questions. And each facility is always different, because I've come into SNF units where it's never the social worker, it's never the DON, it's still controlled by the administrator. So you need to go into the administrator. This is why it's important to be able to ask when you're presenting who else are the key decision makers when a patient needs to be referred, because you want to be able to make sure that your presentation covers every single one of them, and that they know about your product, they know about your services. And that's what's going to happen if you can get in front of them, find out the real decision makers, not those fake decision makers who we think they are the main decision makers. It's what's going to be able to shorten your cycle, because you're presenting to the right person.